I was just going to ask you one quick question while you're up here. So why do you think Australia needs these standards in particular? Why is it so important that we have these standards?
We know that recognition of the importance of delirium is in its infancy, and there's fantastic support in the room for improved care for delirium, but there's a lot of people out there who don't yet realise the importance of delirium, and we need to communicate that to them, communicate that message.
And what do you think it'll mean for improving both the detection and the treatment of delirium, having these standards out there?
I think this will be a huge advance on current care for people with delirium, and it will really improve outcomes for patients in hospital and for their carers. Because if we can reduce the duration and severity of delirium, we can increase the number of people who go home to lead happy and healthy lives rather than ending up dead or in aged care facilities.
That's great. Thank you very much. Please thank Professor Kaplan. Thank you very much. Thank you, Joan. Thank you so much. It makes such a difference to have the patient and the carer perspective. We really, really appreciate you coming forward and telling your story. What sort of difference, you touched on it, but what sort of difference would it have made, do you think, if these standards were in place when you were dealing with this and Michael was dealing with this?
Oh, I think undoubtedly we would have been involved from the beginning with the clinical care staff. We would have been very much involved in contributing to them understanding any particular changes that were different, because we knew Michael very, very well, and we knew on each of his presentations in the hospital that I've described that he was different. There was something very, very wrong. So that working together in partnership with clinicians would have been a significant difference and will be a welcome change with these standards.
And also, just to touch on your role as a carer, what difference would it have made to you as a carer to have these standards in place?
It would have been an immense relief to understand what was actually happening to Michael, to understand the seriousness of delirium and what it could bring to him and the changes it would make. And it would also help us be involved much more helpfully, much more effectively with the clinical care team in his care throughout the whole course of his admission. I felt we would have been much more effective, much more understanding. So again, the standards will be terrific in supporting this.
Thank you. Thank you so much, Joan. Please thank Joan again for her. Before you finish off, I just wanted to ask you, what are some of the challenges, you touched on it a little bit, but some of the challenges of identifying people who come into the emergency department that they have delirium? What are some of the challenges you face in that fast-paced environment when they might be missed for the more acute patients?
I think the problem is that the patients are often there by themselves, so knowing whether their behaviour is their normal behaviour or it's a change from normal is actually one of the big problems. I think every subspecialty in medicine has a group of patients that need to be seen urgently, so the trauma patients or the AMI patients or the urinary retention patients. So it's actually trying to develop something that's actually urgent and important for older people, I think, so that we can actually make sure that we see them sooner rather than later.
And you touched on it a little bit, but what do you think are going to be the main ways that these standards will help patients in the future?
Oh, I think the most important thing is it's make a strong message that it's important.
Putting it as a priority. Mm-hmm. That's great. I'm sure most of the people in this room would agree with you. So everyone thank Carolyn for her talk. Thank you.